Martinez. How are you?
I'm doing good.
Okay, so today we're going to be assessing the lower leg, ankle, and the foot. And in this video, we're going to be assessing his dorsiflexion, active range of motion. And I'm going to be using my goniometer to measure his range of motion. So normal range of motion for dorsiflexion is actually 20 degrees. So we'll see how far he can go. So we're going to have the fulcrum on his lateral malleolus right over here. So as you can see right there. And then we're going to have the stationary arm aligned with his fibular fibular bone. And then we're going to palpate it right over here so we can see it's aligned. And then the moving arm is going to be with parallel with his fifth metatarsal. So see right over here. Okay. So we're starting off right now at 80 degrees, and I'm going to ask for him to go ahead and dorsiflex. Go ahead. As you can see that. Move it. Okay. So it shows that he actually moved exactly 20 degrees. It went from 80 to 100. So if I look under that, it has, it's under the 10 degree mark, but 80 and 100 minus 80 is 20. So we're gonna go ahead and do it bilaterally now and see the difference in his ankle. So we're gonna do the same thing with the fulcrum, stationary arm, and his moving arm. Same thing here. Go ahead and dorsiflex. Oh, we started at 80, by the way. So we're gonna move it now. This is a little bit less. It reads 15 degrees. So it went from 80 to 95. And everything looked good in this video. Did you feel any pain doing that?
No.
Okay. So, okay, now we're going to be doing passive range of motion, and this one is going to be called the talocrural anterior glide. So my patient is going to be lying on his chest, and I'm going to be having my resistance hand, or actually my stabilization hand, on his distal tibia and fibula, and then I'm going to have my resistance hand by his calcaneus and his talus, but kind of like cuffing it so I can anteriorly glide those bones. So we're going to go ahead and test that out. Everything feels fine here. So we're going to go ahead and do this bilaterally. Do the same thing. Right over here, stabilization hand, right, same thing, and over here. So we're gonna do that. Okay, so did you have any pain here?
No.
Alrighty, so the end field should feel just like his ligaments kind of just like having a little bit of flexibility, not too much. And what I felt here was pretty normal, so now we're going to be doing manual muscle tests, and this one's going to be for his ankle eversion. And I'm going to go ahead and palpate his fibularis longus and brevis by asking him to evert his ankle. Go ahead. Okay, so I can see and feel him right over here, and his range of motion looks pretty nice. So I'm going to go ahead and apply resistance. You can go ahead and relax. I'm going to have my stabilization hand on the medial side of his tibia, and then I'm going to have my stabilization hand on his lateral foot, or his fifth metatarsal. And I'm going to go ahead and ask him to do it again. Go ahead. Okay, go ahead and relax. And then, so that one actually assists his fibularis brevis. And now I'm going to try to see his fibularis longus by resisting on the first metatarsal inwards of his foot. Go ahead. Okay, good. Okay, and another muscle that correlates with this ankle eversion is the extensor digitorum longus, which runs down by the fibularis down to his second through the fifth metatarsals. So everything looked nice here, so we're gonna go ahead and flip you over to try the other side. Okay, there you go. So we're gonna do the same thing. Gonna ask for him to evert his ankle. Go ahead. Great. I'm gonna did with the inner side of his foot. Go ahead. Okay, good. All right, so everything seemed nice here, and we're done for this. We're going to be doing special tests, and for this one, we're going to be doing the anterior drawer test. For this test, it's usually ruled in and out because the sensitivity is 29 to 84, and the specificity is 60 to 100. So the pathologies are better to be ruled in and out. Things we're looking for in this test is laxity and instability in the ligaments of the ATF, the CF, and the PTF. So we're going to go ahead and start. I'm going to have my stabilization hand on his distal tibia and fibula, and then I'm going to be having my my resistance hand on his calcaneus, which is his heel as well. And first I'm going to be looking for a subtalar neutral position. So I'm going to be palpating his talus to see how that feels. Do it back and forth, so that looks good there. So we're going to go ahead and anteriorly move his heel upwards to the ceiling. Any pain there?
Nope.
Okay, so now I'm going to do this bilaterally. Everything looks fine on that ankle. So we're going to try it on this one now. So same thing, resistance hand, distal tibia, and then stabilization hand on his heel. I'm going to have it on neutral position by hitting that. Okay, now we're going to start it. Okay. So everything looks fine. His ligaments look flexible, but not too flexible to the point where he could sprain anything. And so it looks like he has a negative test for this one. So okay, so for this test we're going to be doing the external rotation and dorsiflexion test, and we're looking for syndesmotic injuries or tibiofibular ligament and deltoid ligament sprains. And for this test it's usually ruled in because the specificity goes up to 81, which is an okay score, and then the sensitivity goes only up to 71. So that one, if you're negative, we don't really know. We'd have to try other tests. So now we're going to be starting the test. My resistance hand is going to be on the bottom, the lateral side of his foot, and my stabilization hand will be on the distal area of his tibia. So I'm going to go ahead and start to dorsiflex all the way up. And I'm going to externally rotate his ankle. Do you feel any pain there?
No.
Alright. So we're going to go ahead and do this bilaterally just to see if there's any pain over here. So I'm going to do the same thing, distal, and then right over here. Yeah, right. So I'm going to do the same thing. Any pain?
No.
Alright, so like I said earlier, a positive test would indicate pain or a syndesmotic shock on the fibular side of his ankle, and laxity on his ligaments. And everything looked fine, so I would suggest this test is a negative. And okay, so now we're going to be doing palpations, and for this one we're going to be looking for the fifth metatarsal. And I'm going to be starting on his right leg, just so you can see on his lateral area. So his fifth metatarsal is going to be right where his pinky is at, but right before the actual pinky, which is his phalanx. So I can feel it right over here. And what is connected to the fifth metatarsal is the cuboid right over here. So everything looks fine over here. So I'm going to go ahead and do it bilaterally, just to see anything. Okay, everything looks fine here. So we're going to go ahead and move on to the next. For this last palpation, we're going to be looking for the fibularis longus tendon. So to look for that, I'm going to have my patient on his side, and I'm going to ask for him to evert his ankle, just like that. So go ahead. Try it again. There you go. So you can see it right over here, and I can also feel it too. And the way I know that is because the tendon is actually the most superficial one from the brevis, and the brevis would be like right under it in a way. So everything looks good here. So we're gonna go ahead and ask him to flip on the other side so I can see bilaterally. Thank you. So go ahead and do the same thing. Can you straighten out your leg? Okay, thank you. could also see it over here. I could also feel it. And do you have any pain over here?
No.
Alright. So everything looks fine on his tendons, and that looks like everything for this video, so thank you for watching.